put me down on the side that glad that Congress passed the Affordable Care Act. I'm proud that millions of Americans have been able to be helped by it. And I'm going to share one letter with you. I could share literally with you hundreds of letters that I've received from constituents that have benefited from the Affordable Care Act, people who no longer have to worry about pre-existing conditions. That pre-existing condition could have been the fact that you're a woman, could have been the fact that you gave birth, could have been the fact that you're a victim of spousal abuse, could have been any one of those matters, could have been you have asthma. All those are pre-existing conditions, and you didn't have full coverage. We've eliminated now the cap on health care. Medical bills was the leading cause for bankruptcy. Well, that's going to become a thing of the past as we get people covered under health care. We now have affordable options. People can now afford to buy health insurance. They're getting a quality product. The product has to cover certain services. Like when you get sick, it's got to cover it. It also covers wellness. So we're changing the healthcare system from a sick system to a healthcare system to keep people healthy. And that's what our objectives here. For Medicare patients, we're eliminating that coverage gap, donut hole. So many seniors had to decide whether they could literally afford their prescription medicines or to come in a pill and half because they couldn't afford it. We've extended the life of Medicare by over a decade. So there's a lot of things in here that are not terribly controversial. Keeping your children, adult children, in your policies at 26. None of these seem to be controversial when you talk about them one-on-one. So we get to what seems to be all the fuss about. And that is we're trying to get everybody in the system. We think it's wrong for some people to pay and other people not to. People use the system in a more costly way than they should. So we're trying to get people to use the system in a friendlier way and make it affordable. And that's the foundation of the Affordable Care Act. So the rollout of the exchanges was a disaster. I acknowledge that. It was terrible, no excuse for it. It should have been done in a much more friendly way. We had an objective to get 7 million people enrolled in private insurance by the end of March. Well, we're at 6 million. So we're not, we're moving along. We're getting people enrolled nationwide into the exchanges. In Maryland, we're not doing very well on the private insurance. We're going to be up to around 50,000. We want to be much higher than that. We have 250,000 that we've gotten enrolled because of the Medicaid expansions, which are very, very important. We can do a lot better. And when we say we're not doing well, we're sorry that we're not going to have more people insured. The system's going to work. It's going to work a lot better than it did in the past. And next year, we'll have a lot more people in the system. And we will get to that point where the overwhelming majority of Americans are in the system, and therefore we can restructure the healthcare system to make it more cost effective.